dying client feel comfortable. Providing comfort care is imperative for clients who are nearing death. This is a type of care that helps or soothes a dying person in order to avoid further suffering or ease their discomfort as much as possible, and to improve the dying person's quality of life while respecting his or her personal wishes. In this video, we will discuss measures in how to provide comfort to dying clients according to the concern or problem they are facing. The client is not eating or drinking. This is a natural part of the dying process, since the body is protecting itself from taking in more than needed. While it is normal for family members to worry, end-of-life persons are less aware of their hunger, thirst, and discomfort already. Give the client small spoonfuls of food. Do not force the client, as swallowing becomes more painful for them.
Please, sir, you need to take a small bite of your food. You need energy.
Moisten the mouth by giving ice chips or by wiping the mouth with a damp sponge. The client has a dry face. Wipe around the client's eye using a damp cloth. Apply lip balm or petroleum jelly to moisten their lips. The client has a fever or having difficulty breathing. When a body is near death, it usually changes its breathing pattern and temperature. Fever may be caused by an infection, dehydration, or a disease itself. Breathing may become irregular and have long pauses called apnea. Minutes before death, a person will have an irregular breathing pattern, give shallow gasps, and then stop breathing altogether. Turn the client's head gently. Adjust the pillows or raise the head of the bed. Use a cool mist humidifier. Consult with the rest of the medical team about medication or the use of oxygen. Make the room well ventilated. Direct a source of air across your client's face to diminish his or her air hunger. Give the client paracetamol to comfort him or her from fever. This can also be administered rectally. Put a cool and damp washcloth on your client's forehead, armpits, or groin area to help lower fever and make them more at ease. The client has irritated skin. Gently rub lotion onto your client's dry skin. Maneuver your client safely in bed to avoid the development of sores. The client is suffering from incontinence. Put incontinence pads on the client's bed, or make use of adult diapers or urinary catheters. Make sure to manage this regularly. The client is experiencing feelings of confusion, agitation, anxiety, restlessness, and other mental changes. End-of-life persons experience many different things simultaneously, such as pain, discomfort, and effects of medication that they find it hard to articulate exactly what it is they are feeling. This is why they resort to expressing agitation and restlessness and feelings of confusion and anxiety. Speak calmly and be reassuring to your client.
Good morning, Sir Eduardo. Is there anything you need right now? Are you feeling any pain?
Provide a gentle and comforting touch to the client. Try to determine the cause of your client's negative feelings. This will help you identify the appropriate treatment for comfort.
Is your arthritis getting worse? Let me prepare a hot compress for you.
Remind the client of who you are and his or her location.
I'm here for you, sir. You are at a home for the aged. Let me apply this hot compress so we can relieve the pain in your shoulder.
For significant and uncontrollable agitation, ask assistance from the rest of the medical team. The client is in pain. Not all dying people experience pain. Pain felt when nearing death can signify a new complication, such as a progressing disease. The body emits natural pain relievers when nearing death. Administer prescribed pain medication. Do not skip doses. Consult with your client's doctor if you see the need to adjust medication and if the client's pain is getting worse. You may observe this from how your client is acting. Look for signs such as wrinkling in the forehead or if he or she is touching body parts not usually touched.
Hello, Doc. Sir Eduardo is in pain. I think its condition is getting worse. Can you check up on him?
Take note of symptoms brought on by pain, like nausea and anxiety, which can worsen if pain is not managed. Try giving your client a warm compress or playing his or her favorite music for a bit of distraction.
Sir, do you want me to play your favorite music?
The client is being sensitive to temperature. Observe if your client is feeling hot or cold. Adjust the room temperature and bedding as necessary. The client is experiencing spiritual and emotional changes. Always assume that your dying client can still hear everything that you are saying. Talk clearly and directly, and watch out for nonverbal responses such as facial expressions, sounds, or slight movements.
I'll be monitoring your vital signs right now, sir. So I'll start with your blood pressure. Are you feeling any pain right now?
Be careful and sensitive of what you say to other people in the presence of your dying client.
Do you have any concerns about his condition?
He is more responsive now. I'm sure he will improve soon.
Use phrases of gratitude, affirmation, and preparedness when talking to your client.
I'm sure your family will remember you fondly. You have been such a huge inspiration to them.
Honor your client's dying time by building a suitable environment that will be appreciated by your client. Provide reassurance to your client who is feeling fearful and anxious.
I'm here for you, sir. You can rest for a bit. When you wake up, I'll still be here.
If family members are not physically present, which can be common among those who work abroad, contact them so your client may hear from them. It can be through a phone call or video call. Explain what you're doing to your client.
Sir, I'll fix your pillows so you can rest your head more comfortably.
Use words that would help maintain your client's dignity.
Sir, we need to change your padding.